Hello, my name is Ashley. I'm going to be your nurse for today. The doctor has ordered a full physical assessment for you. Can you verify your name and date of birth for me?
Katrina Howell, 4/25/1972.
All right. Is it okay if I do this physical assessment today?
Sure.
All right. Do you know where you are?
Yes.
All right. Where are you?
I am in the emergency room.
Okay. Do you know what the year is?
Yeah, this is 2021.
Okay. Do you know what brought you here?
My car.
Okay, so you would label this AAO times 4 because she knows the date, her name. She knows why she's here. And anyway, meet my mother, you guys. Okay. Alright, so what I'm going to explain to you now is the Glasgow Coma Scale. It's a scale where you test your best eye response, motor skill response, and verbal response. So your speech sounds good, so that's a good verbal response. And you're looking at me, you're very aware of what's going on, and your eyes are moving when I move, so your eye response is good. Your motor skills, can you move around for me? Showing good signs of motor skills. Hold up, number 1, 2, 3. Alright, she has good motor skills, so she would score pretty high on the Glasgow Coma Scale. Whenever they score 8 or below, it shows severe signs of brain damage, and then if you score between a 13 to 15, you show signs of mild or no brain damage, and she's showing no signs of brain damage. Okay, so the next thing that we're going to do is assess how you're dressed. You're dressed very appropriately for where you're at today. So that would cover that. And what we're going to do now is I'm going to assess your head. We're going to notice that she has no deformities or abnormalities around her head, and there's no visible signs of masses. And I'm going to feel along her scalp. Alright, her scalp looks good. She has no signs of dandruff or anything. Her scalp feels very normocephalic. Alright, and then her skin is appropriate for her ethnicity. Feel your skin. Her skin is warm. Alright, and then we're going to test your skin. Alright, that was your timer. I'm going to test your skin to see if it'll retract. So we'll do that by pinching up, and that retracts, and then the best place to do it is right here by the collarbone. She's not dehydrated. Alright, so we're going to move from your head to your ears. Alright, your ears are symmetrical. Ears are symmetrical and in alignment with your head. Are you having any hearing problems?
What?
Do you wear any devices that would mess with your hearing?
No.
Alright, are you having any headaches today?
No.
No? Any itchy scalp, anything like that?
No.
Alright. Next we're going to assess your eyes, and with this you would use your pen gauge and your light, but I don't have one today. Alright, so her pupils look like they're at a 3, and are you having any trouble seeing? Any vision problems?
Yeah, close up.
When was your last eye appointment?
2 years ago.
Okay, you may need to go and see your eye doctor then. Alright, so we're going to do next the Perla test. So you're checking the pupils to see if they're equal and round and if they react well with light. And then you would do accommodations, but we're not going to do the accommodations today. So what you would do is you'd shine the light in her eye, and you'd want a 50% constriction in the eye that you're shining the light in, or 100% constriction in the eye that you're shining the light in, and 50% in the opposite eye. So you'd shine the light and shine the light, and hers would constrict if we had the appropriate tool. Okay, so next we're going to go and assess your nose. Are you having any trouble breathing?
No.
Any excess mucus?
No.
Alright, we're going to do a patency test. Can you plug one side of your nose for me and breathe out? Alright, and do the other side. Alright, she shows no sign of trouble with that. With your ears, are you having any drainage in your ears? Any buildup of earwax?
No.
Alright, the next thing that we're going to do is assess her mouth. Can you open your mouth for me? Alright, she shows no signs of dental decay, and her oral mucosa is pink and moist. Her lips are pink and moist, so all of that looks good. Are you having any pain in your teeth?
No.
No? Alright, so the next thing we're going to do is assess your neck and your shoulders. Your shoulders look to be in alignment with your body, and your neck is good. Can you hold your head to the left for me? Alright, and to the right. What I just did was check to see if she had any distension of a vein, where we check for JVD, so she shows no sign of JVD. And the next thing we're going to do is check and see if the trachea is in midline, and check her swallowing. Can you swallow for me? Are you having any trouble swallowing?
No.
Alright, so there's no pain, no trouble swallowing, and her shoulders are in alignment. The next thing that we're going to do would be we're going to check her carotid pulse. So you do that, you do one at a time, you never do both. So we're going to check those. I'm going to check the other side. Alright, so her pulse is about a 2+ right there. And I'm going to point out all the other pulses that you can go through. Can you hold your arms up for me? There's an axillary pulse under the armpits, and then you could do the brachial pulse, which is going to be on the inside, and then you'll do radial pulse, which is on the side with the thumb. It's going to be on the outside, and you'll do that bilaterally. There's also a pulse in the femoral artery, and down below the knee is the popliteal, and then you have one on your foot. It's your dorsalis pedis, and then you have your anterior tibial. You can also check those. So the next thing that we're going to do is I'm going to check your cardiac and respiratory systems. Are you okay with that?
Mm-hmm.
Are you having any chest pains, shortness of breath?
No.
No? Okay. So we're going to start out listening to your heart. And so what you're going to do is you'll find the first intercostal space and feel down for that second one. And this is going to be your aortic artery. And then you'll move over to the pulmonary artery. And all of this will be done below the shirt, but for video purposes, we're not going to lift our shirt up. Then you're going to move down to Erb's point. And then you'll do the tricuspid valve. Can you lift up your... And then we're going to go right down here. You'd go to the 5th intercostal space in the mid-clavicle, and you'd follow that all the way down. And this is going to be the point of maximum impulse. It's the mitral valve. You'll listen to it for a full minute. Alright, all of her heart sounds sound good and clear. Everything, you hear the S1 and S2 sounds. There's no type of abnormality in that. If you wanted to test out to see if you could find a murmur, you'd flip it over to the bell and listen in all of those points again. And so the next thing that we're going to do is listen to her lungs. So you always start to the left of the patient. This is going to be the right upper lobe. Take a deep breath. Then you're going to go left upper lobe, left lower lobe, right middle lobe, and then you'll go to the side and do the right lower lobe. Alright, and then you'll go to the back. And you start to the left again, so this is the left upper lobe, right upper lobe, right lower lobe,
I'm gonna pass out.
and left lower lobe. Alright, all of her breathing sounds normal, and there's no adventitious sounds between her lungs and every different lobe. So the next thing that we're going to do is we're going to check your capillary refill. Can you hold out your fingers for me? So what you want is for the color to come back within 3 seconds. Her capillary refill seems to be doing good. What we're going to do now is check for edema in the upper extremities. Flip over. You'll do this bilaterally. She shows no sign of edema in the upper extremities. We're going to check the lower. Alright, no signs of edema there. So what I'm going to do now is do her gastrointestinal system and then her urinary. Are you having any trouble urinating? Any pain?
No.
No? Okay. Alright. Are you having any trouble using the bathroom? Going?
No.
When was your last bowel movement?
Yesterday.
Okay. Was there any pain during that?
No.
Alright, how many times do you... That's a big old wasp. How many times do you, usually use the bathroom in a day?
Once.
Okay. Is that regular
Just
for
give me
you?
one. Yeah.
I'm killing wasps. Alright. So the next thing I'm going to do is we were gonna lift her shirt up, I would check to see if she had any lesions, scarring, any distension in the belly. But what I'm gonna do now is I wouldn't pause like this in a normal setting, but then if y'all can't see, there's a big old wasp in here. Anyway, alright, so what I'm gonna do now is I'm gonna feel around, or no, we listen, we don't feel just yet. So I'm gonna listen to her bowel sounds to see if they're active. You'll start in the right lower quadrant, and you'll listen for a full minute, and if you don't hear anything, you'll listen for 5. Then we're gonna go to the right upper quadrant, left upper quadrant, left lower quadrant. All of her bowel sounds are active in all areas. Next, what I'm gonna do is palpate her stomach to see if there's any pain, and you'll start in the right lower quadrant. Is there any pain whenever I do that? And if you wanted to look for an abdominal aortic aneurysm, you would flip your stethoscope over to the bell and you'd listen right about here. And that's going to be in between. You make a little house and you go these 2 points, these 2, and then you'll go right about here. And that'll be where you test for that. Alright, so you sound good there. What we're going to do now is test for your that thing needs to die. We're gonna test her range of motion with and without resistance.
Be careful.
Okay, we got a boo boo. All right, so flex, extend.
Am I doing an arm or hand?
We're doing the elbow. So flex, extend. All right, now we're gonna do it.
That's extend. That's flex.
Yeah, extend. All right, flex. All right, now we're gonna do it with resistance. Extend, flex. All right. And you would do that on the other side. So we're gonna do her wrist now. Flex, extend. All right, now flex, extend. All right. There's no signs of popping or cracking in that area, in those 2 areas. Whenever I performed that, was there any pain whenever that happened?
Yeah, when you touch my baby.
I'm sorry. Okay, so now what we're gonna do now is the knee and the ankle. So you're gonna flex, extend. You're gonna do it with and without resistance. So flex, extend. All right, and do the ankle. So you're gonna plantar flex, dorsiflex. All right. There's popping in the right ankle that time. Was there any pain whenever that happened?
No.
All right. Are you experiencing any pain today?
Yeah, and my boo boo.
In your boo-boo? Okay. So, what would you rate your pain as?
Like a 3.
Like a 3? Alright, so how would you describe it? Is it burning?
Yes.
It burns?
Stings.
Okay, what makes it better?
Nothing.
Okay, what makes it worse?
When you touch it.
Okay, I'm sorry. Well, I will be sure to let your physician know what we found today, and thank you for being here. This went very well.